Hello there, my name is Hilary Nelson. I'm a critical care nurse and I'm based up here in Forth Valley in Scotland. I've worked in intensive care for about 24 years now and I've been an RCN steward for 2. So I work in a 19-bedded critical care facility, and over the last few weeks there's been a lot of preparation going into expanding that facility and increasing our footprint to deal with the patients that we may be asked to see, and also looking at different systems of working in terms of the introduction of PPE when we're caring for patients with COVID-19, and also the challenges that poses for us. So there's a lot of preparation work and a lot of work gone into teaching, education, upskilling people, and obviously bringing people back into the area to assist us provide the intensive care to patients. On the side of being a steward, we're working in a very different way also. The world's a very different place, and it's important that we continue to support the members that we have the best we can. And as I say, the landscape has changed, and so we're not seeing members as much face to face. A lot of what we're doing is over the phone. And that in itself is tricky at times with technology, but as I say, we do have members who continue to reach out to us, and we will continue to support them in the best way that we can. So hopefully over the next few videos, as I say, I'll be able to share a little bit of the work that I've been doing in both sides of the role that I do. Today I attended the hospital safety huddle this morning, and I drop in fairly regularly. It gives me a lot of information about how things are going and any issues that may be arising that will affect our members. So over the last 7 weeks I have been attending the huddles regularly. I did so pre-pandemic, but more so now, and just gauging what is actually happening. So at the very beginning, the issues for our members were things like PPE and the availability and the wearing of the PPE in different areas, and the guidance changed so much, so we were reassuring members with the most up-to-date guidance and what they should be doing to keep themselves safe, and also dealing with all the worries that they had and talking that through and signposting them to other supports such as occupational health, counselling if they required that, signposting them to the RCN information, etc. We also have huddles 3 times a week to feedback on any issues specific to COVID-19, so we attend those also and feed that back into our officers regionally and senior officers to see what the local issues are on the ground. And this afternoon we had a conference call with staff side, so we come together as a collective staff side to discuss the issues, anything arising, and go over the guidance and make sure that our members are continually supported. So that's been my day today, a full day of steward duties, and hopefully things will keep going and that I'll be able to support my members throughout this. Had a good day today. I attended the hospital safety huddle, and then I did a walk round of one of the wards within the acute site with the chief executive, the director of nursing, and a couple of other senior managers. The purpose of the visit was just to go and say hello to staff from the senior team, and they asked staff side to come along with them for that. And it was really good to get out and meet some members again. And one of the things that we were highlighting was the creation of breakout rooms within each ward. Currently we don't have very many visitors coming into the hospital, and we had asked that these rooms be turned into hydration stations for staff to go and have a drink and take 5 minutes, particularly if they were having a tough day. And the feedback from staff has been so positive, it's been amazing. They really feel that it is helping within their work environment to keep them hydrated, to keep them concentrating, and there's some real camaraderie about it. So it was also good because I got to meet a student nurse who was an RCN member, and she was telling me about her experience of being out, and she was really positive. She said that she's been very well supported and that she's enjoying her placement. We also got to meet some healthcare support workers and some registered nurses within the ward environment, and they were having a good day. So it was really a positive experience to go out and see the hydration stations in action. And for me, the feedback from staff speaks for itself. So we will absolutely look at the sustainability of this for nursing and staff in the future.